I'm delighted to discuss the latest developments in neoadjuvant therapy in retroperitoneal sarcomas. The first thing to highlight is that the STRASS trial results have been published in the Lancet Oncology, and this was a randomized trial of preoperative radiotherapy plus surgery versus surgery alone. And this was the first successful international Phase III trial in retroperitoneal sarcomas. And in terms of the primary endpoint, there was no difference in abdominal recurrence-free survival between the two arms at 3 years. But there was a possible signal in improvement in abdominal recurrence-free survival in patients with liposarcoma. So I think this is a very important trial and clearly shows that it's feasible to perform randomized Phase III trials in retroperitoneal sarcomas. And this leads on to the current randomized Phase III trial run by the EORTC of neoadjuvant chemotherapy in retroperitoneal sarcomas. And this trial randomizes patients with operable disease to either receive surgery or neoadjuvant chemotherapy followed by surgery. And for patients with liposarcoma, they're treated with doxorubicin and ifosfamide. And for patients with leiomyosarcoma, they're treated with doxorubicin and dacarbazine as the chemotherapy schedule. And the primary endpoint of this trial is disease-free survival from randomization. So clearly this is a very important randomized Phase III trial that's recruiting patients currently. We also have a translational aspect to this study with an accelerator sarcoma grant that will be looking into biological specimens collected as part of the EORTC STRASS-2 trial. So in essence, those are the major things to highlight in neoadjuvant therapy for retroperitoneal sarcomas.